Okay, I've got to tell y'all about crazy experience I had yesterday that left me like so angry and upset for hours. It took me forever to calm down, and it, it bothered me like extra because from a professional standpoint, um, I'm a graphic designer, and one of the things I specialize in is user experience, which is basically like when you're designing, like, whether it's a design or a process for something, like thinking about how people actually interact with it. And is it intuitive? And does it make sense? And does it communicate clearly? And all of that good jazz or whatever. So, from a professional standpoint, I was just like, wow, how is this messed up? And so the thing is that I was trying to get a hold of someone through my insurance company yesterday. So as I posted before, like I'm finally looking into doing weight loss surgery. I probably should have done it like a decade ago, but I'm just stubborn as hell and was always like, I'm going to get this weight off myself or whatever. But anyway, so I've decided to look into weight loss surgery, and I called my insurance company last month and talk to them about like what does my plan cover and how do I get started with this and all of that. And they're like, they told me what they cover, and they told me that I needed to sign up for this other program called Optum that, like, I guess helps manage the process or something. So I signed up for this program, and I signed up through it over the phone. Like, my insurance company connected me to them. I signed up over the phone. The person on the phone said they were going to send me, some emails, and they scheduled an appointment with like a nurse case manager or something like that, um, for like next month. And yeah, so I get a couple of these emails, and I didn't notice how messed up and complicated it was at the time. But I get a couple of emails, and they're not actually very clear. Like, I get one email that's like an activation email that's like, click this link to go activate this thing on this website. And I went through that process and ended up on a website where I could see like a messenger, like a private messenger system, because they didn't want to like email me directly the welcome packet for this program. They wanted to be all like secretive about it or whatever and do it through this third party platform, which is super inconvenient for me. Um, but anyways, so I got this message on there. I knew it was there. Well, it's been a month, and they had sent me, the message that was on their platform was where they sent me like a list of like three providers that I can go to in my area, to have the surgery, because I have to like I have to use, I think they call it like a blue distinction host. I have to use like a certain doctor, and I'm gonna have to do like a physician supervised diet for a specific amount of time. And I think I have to do like a psych eval. Like, there's this whole big process before you can like like actually like have the surgery, because like it's a big deal, and there's stuff that you have to do like before and afterwards or whatever. Anyways, they send me a list of three places. I kind of look at them all. I talk to some other people that have had the surgery and stuff, and pick one that I want to go with. I contact them. I sign up for, like I do this orientation video, and I sign up for, like a consultation with them. Well, the service provider messages or calls me or both and tell me that um, I need to contact my insurance company and make sure that I'm signed up for like their bariatric program or whatever. And I was like, well, I think that's what this thing I already signed up for is, but let me call them and double check. Because when I had talked to Optum over the phone, they told me that I would probably just need to do like 3 months of a supervised diet, but then the hospital, the one I'm looking at is Brookwood Baptist Medical or something like that in Birmingham. Anyways, the hospital's like, well, they like, from what we've been told, you have to do 6 months. And I'm like, man, that sucks, because I'd really like to do this like in December if possible. That way, if I have the opportunity to teach in the fall and the spring, like it wouldn't interrupt like like my ideal job plans. Um, anyways, so they're like 6 months. I'm like, okay, well that's weird because they told me 3 months. Anyways, they told me to sign up for the program, so I was like, okay, well I'll call them. And the service provider that they were like, they told me they're like, well you can use whatever doctor that you want to for the program and stuff like that. And I was like, well let me just call and make sure, since this is apparently like a big interwoven complicated thing. Anyways, so yesterday I tried calling my insurance company to ask them. Well, actually, the first thing I did was I went to my email to see what all Optum had sent me, trying to find like the link to this website that I had once gotten to and had like this message in. And I go to one of the emails. I had two emails from them. One was an activation email, and the other one was something else. And I think I clicked the link on the other one first, and it took me to a website where there was absolutely nothing mentioned about bariatric surgery. And when I tried to log in, like it wanted me to choose like from another like sub site to log in, and none of them were like an obvious choice. And not only that, but the program was called Optum, and when it took me to a website, that website was like One Health ID or One Health Center or something. And then eventually later on, when I actually figured out how to get to the page with the messages or whatever, like the name was also different. It was like the URL was like Personal Wellness Center or whatever, and that was like the logo on the thing. So like there's a lot of confusion because like these emails came from Optum.com, but when I go to Optum.com, it sends me to like two other places without actually telling me that it's going to send me to another place first. So no wonder, like I'm having trouble trying to find this stuff because like their stuff is unclear. It doesn't make sense. Anyways, I couldn't get to the website, so I tried calling Optum's support number, and then I tried, which I didn't get through to anyone at first, and then I tried calling Blue Cross Blue Shield. I was like, well, you know what, let me just call them, and I'll ask them some questions, and I'll also ask them, like, how the hell do I contact Optum? Guys, I can't even tell you how many times I tried calling Blue Cross Blue Shield. Like, I called so many times, like, I mean, definitely at least 6, maybe 12 or more, but I would call and like none of the options were obvious. I mean, like one was healthcare, and so I went down that path because I was like, well, this is healthcare, but then none of the options were relevant for what I was trying to do. But I still like kept following down the path to try and get to a representative, and then I would try and get to a representative, and instead of like there being like a voicemail or something or like a person that would answer, I'd get like one of the messages I got was like, this circuit is currently busy, blah blah blah, like no follow up. So I called back again, and I went down like the very first option that they have is something called quantum coordinator. I'm like, what the hell is that? Like, why not use, like, if that's supposed to be like a healthcare representative or something, like why not use like an actual descriptive term that like a normal person that's not in the industry would understand? I mean, because quantum coordinator just sounds like some sort of mysterious Illuminati like title or whatever. Like, what the hell is that? Anyways, and what the hell is quantum? I'm calling Blue Cross Blue Shield. Like, what is this? Like, if you got a different name for something, like, describe it so that people that call know what the hell you're talking about. Anyways, I went down that path a couple of times, and once again, like, could not get a person, could not get a voicemail. So eventually, I was like, you know what? Like, I'm gonna get through to somebody. So I kept calling back and going down all the paths, and eventually I went down one that had something to do with, I think, auto and home insurance. And wait, actually, before I went down that path, I got a person at one point in time. I have no idea which path it was I followed that I got a person, but I got a person at one point in time, and I told them that I had called the month before, and that they, about bariatric weight loss surgery, and that they had told me to sign up for this program called Optum, and I was trying to, get some questions answered and get in touch with Optum so I could figure out how to get where I needed to get on their website. So this person is like, okay, well, I can connect you to them. So they connect me, they transfer me to Optum, and I spend 5 to 10 minutes on the phone with a very nice young woman who could not find me in their system. And I'm like, well, I called last month, and I've got these emails, like, I'm definitely in your system or whatever. And I don't know, 5 or 10 minutes later, at some point, at some point she tells me, I'm talking to her and I'm like telling her like this is about bariatric weight loss surgery, blah blah blah. And at some point she's like, "Well, we're a bank." A bank. A bank. Blue Cross Blue Shield forwarded me to a bank. I mean, I guess they're partners with this bank, like maybe or whatever. And she's like, were you wanting us to finance this surgery through us? And I'm like, no. I'm trying to get in touch with the Optum that manages the bariatric weight loss program, not Optum the bank. And why the hell is Blue Cross Blue Shield partnered with two companies with the same name that do two different things? Like, what the hell? Okay, so anyways, I thank her for her time and talk about how ridiculous this is that I was forwarded to a bank when I specifically was talking about a weight loss program or whatever. I call back, I go down the insurance route, get to someone that was super nice and super helpful who gave me like several phone numbers for, like different phone numbers, because the one on the back of my insurance card apparently, like, obviously like wasn't doing the job. And so she transfers me to a different department where I speak with someone, like a very nice guy named Brady, who I talked to and I asked him some questions just to kind of figure out how everything works or whatever. And then I talked to him about Optum. Well, he's on the phone with me and I tell him about, like I'm trying to like log into this website where I've signed up from them, and I had tried contacting their support number and I couldn't get through. And he goes to the website and he sees exactly what I see, that there is no obvious like in order to find, like, there is no mention of bariatric services on the website. When you go to sign in, there is no obvious place to log into for this service. Now, a Google search, when we Googled the name Optum and bariatric surgery, brings up like a secret page or a hidden page or whatever that has some information about requesting information and stuff. It doesn't have anything about how to log in or anything like that, just request information. So not very helpful, but at least there's, there's something, there's like a little bit of a breadcrumb. So he gives me a few more phone numbers and tells me a little bit about what each program is supposed to do. And I think he told me and here's one of the other confusing things that happened is like Blue Cross Blue Shield told me that Optum is the one that decides whether I need a psych eval and how long I have to do dieting or whatever. But then I finally get a hold of Optum and they tell me that, well, Blue Cross Blue Shield decides this, and the service provider, the hospital, is actually the one that decides how many months you have to do a diet and whether you and they say Blue Cross Blue Shield. See, Blue Cross Blue Shield says that Optum requires the psych eval. Optum says that Blue Cross Blue Shield requires the psych eval. Blue Cross Blue Shield says that Optum is the one that decides how many months I've got to do like a physician supervised diet before weight loss surgery. But Optum says that it's the service provider that decides how many months I've got to do that. Well, the service provider thinks that it's Optum that designates how many months I've got to do something. And I mean, guys, like, no wonder people are so frustrated with our freaking insurance system. These people are freaking idiots. I mean, seriously, like, this is like like healthcare and insurance and stuff is something that so many people have to deal with. Why the hell do we still have these problems? Because there are plenty of educated people in the freaking world, including myself, that know about user experience or whatever, that could very easily, test out these systems or whatever, or talk to other people that have had problems to figure out where the pain points are and like fix the crap so that it actually functions better and makes sense for most people. I mean, I'm sure y'all can tell that I'm very frustrated by it right now, and I'm extra frustrated about it because, I mean, I consider myself to be a fairly intelligent person, and I just know that if I experienced this level of frustration with this system, I mean, I could easily imagine how much more frustrating this system is for other people, and how other people would probably just like give up and not have anything to do with it, and therefore, basically be like penalized because the system is effed up or whatever, and they don't know how to navigate it, or it's not worth the hassle or whatever, and I'm just freaking stubborn as hell, and I'm like, you know what, I'm gonna freaking figure out how to get in touch with someone. I freaking hate, I mean, and this is more than just insurance. I hate companies that do not put direct contact information in obvious places on their websites and stuff. To me, that is sleazy. Like, if you are a reputable company, you should have your contact information, and you should, you know, be clear about, you know, who to contact and departments and all of that kind of stuff, so that people can get a hold of you or whatever. Like, that's just a good business practice, you know. But anyways, all right, well, I finally kind of got some of the information I need, and so on Monday I'm going to try calling like the hospital again and talking to them about what I've been told to figure out the next steps. But yeah, like, I just wanted to to vent this frustration, and also just, you know, I mean, seriously, like, you know, if anybody knows anybody in these companies, they need to just hire me to fix their shit, like, for real. You know, one day, I don't know, I'm working on, I've been working on, I'm trying to set up like 2 businesses at the same time right now or whatever, but like one of the businesses, the one that I spent like a couple of grand on a domain name for, that one, which I don't want to say what the name is yet, because it's going to be a surprise. I want to wait till I get like the branding done or whatever. But, you know, like, I don't know exactly how I'm going to get where I want to get, but I have a dream of eventually growing my design business into like a think tank / you know, global design company or whatever. And you know, I don't know if I'll get to that level, but I'm going to try, because I really feel that there are a lot of problems in the world that could easily be solved if we just brought together like the right group of like an interdisciplinary team to like look at problems and come up with, you know, creative or practical solutions that are based on like research and actual, you know, like user experience cases and stuff. So you know, maybe one day I'll be in a position where I can actually help with this stuff, because this is just a perfect example, you know. And it was so weird because I was experiencing this yesterday, and like, man, life has been like really great lately, like really, really great. And then I experienced this frustration yesterday, and I was like, you know what, you know, like, this is frustrating as hell, but I kind of feel like God is putting me through this experience to remind me of the problems that I would like to solve in the world, if that makes sense, you know. So, you know, it's like, I know that I know one of my superpowers is being able to like flip the script on any situation and be able to, you know, like find like a lesson in things. And so yeah, so this has been a really frustrating experience, but it's also been kind of a reminder and reinforcement that maybe I should try and, you know, like, grow this business that I want to grow. And I don't know exactly how I'm going to get there, but I actually have recently, like, I've signed up. I'm basically in school again or whatever, but it's not through universities, through different online programs and stuff. I think I'm in like 3 different programs right now or whatever. So I'm trying to balance like learning some of these skills I need to make my next steps with the actual work that I have coming in, and, you know, setting up my business stuff and everything. So anyways, wish me luck. And yeah, guys, oh my goodness, if you've got crazy insurance stories, like, share them or whatever, you know, like, maybe if we put together, you know, like enough documentation or whatever of all of these problems, and like find the right person to like send this information to, we can actually get someone's attention to be like, hey, fix your shit for real. All right, anyways, love y'all, bye bye.